And we got the sun, we got the ionic energy from the ocean.
We got the laughter and the humor.
Oh yeah, you know what? We even went to an NLP timeline therapy event. You know, we kind of went to the different.
About that.
Yeah,
that's right. That's we did.
Because the integration of the mind, right?
Yep.
You have to help the mind to get in order with. My unconscious mind is knowing it's wanting to do this,
Yep.
but now it's time to do this.
Or, you know, Nick, I think it's a lot of times for patients that I see, including myself, it's habits.
Yes.
It's habits that we've had for decades. You know, I always went to bed at this time. I always, I have this perfectionist nature, and I have to, life and death depends on me getting this work done. And it's breaking those habits. It's reminding yourself that I don't act that way anymore.
Yeah. So for you as a physician, but having experienced that live-in center situation, that living and walking the talk and going through the exercises, I remember taking you to the beach and we took the dumbbells and you worked out, I worked out, we went through the routines. How long do you think before you noticed a result where just starting to going, well, maybe this is going to work?
Well, I'll tell you that was in days. Within days, I knew that was going, that this was a difference that I had not experienced in the previous 5 years. Yeah. Within 4 weeks, it was unquestionable. Within 9 months, I had dropped 70 pounds. Wow. My energy level had come back up. But I still was challenged at that point at 9 months of, okay, now I can go back to doing the things I used to do it. Ooh. And I had a couple different times where I fell off the pattern, like, okay, now I'm back to baseline, I can start loosening up on this. And you can loosen up, but you can't migrate away from the rules. You can't migrate away from the axioms, the truths that come from of living your life in an integrated method.
Yeah. And now for your patients, having had that real life experience yourself, you look at each person, of course individualized, but you put them through a very extensive software program, you evaluate them through testing, but you send them to the nutritionist first.
Yeah, everybody sees me and everybody sees the nutritionist within the first 5 minutes. But now that you mention it, this is the best diagnostic tool physicians have ever invented, because this allows, through technology, to remind patients to take a breath, to remind patients about how grateful it is, to allow them to categorize and log what they're eating. The simple lifestyle factors. This is going to be this will be the most powerful tool available for clinicians to use with their patients once the proper software is in place.
Yes. Yeah. Undoubtedly, we've been in the development of an app, and we looked at some other ones out there. We said, that's good, but there's some better level, because, you know, the integration involves quite a bit more. You know, once you master nutrition, there's still more to learn with the nutrition, right?
No doubt.
And then there's personalized nutrition for supplements, what's really appropriate, what's necessary, and what's unnecessary.
Right.
And,
all supplements are, you know, patients come in to see us, and as you mentioned, they see myself or my surrogate, my physician's assistant. They also see my nutritionist at the same meeting, and then we come together with a plan for this patient. Frequently it involves weekly nutritional counseling on the phone or in group settings.
Yes.
But also it's not uncommon that patients may leave with a number of supplements on their first visit. And we always have to reassure them that they're not going to be on that many supplements over time, because as the body restores and regenerates and gets back to where it needs to get on health-wise, those supplements start falling off on the wayside. So I think what you said is very important. What supplements to give to the patient then, and what supplements to take away as they're no longer needed.
I think people need to hear how you went about deciding what were the premium supplements to use, because knowing you and your background, your mathematician background, right? Am I correct?
I'm a huge fan. I'm a very huge fan of in-house research.
Yes.
So we literally, through our centers, because at one point I had 40 centers, we actually clinically measured the response and the laboratory values that were associated with different supplements to see which ones were on the best of the market. It is because of that research that now with the new software program, Power to Practice, we actually have that ability as well. So we can actually do clinical effectiveness research on what products are quality and what products are not. Recent studies have shown that up to 40% of the supplements that patients buy over the counter have zero nutrient value in it. That doesn't mean they're not nutritious. That means they're pebbles, they're grains.
We call it window dust.
It's window dust, right?
It's got the name on the label, the ingredient, but such
included.
Small ingredient dose, it's not effective.
Right.
Like you mentioned a little earlier about the effectiveness of some of the things that I've created and formulated. You know, I have to
You're one of those companies that I can recommend to patients, because if you're a clinician and you see patients frequently, they will all come in with supplements like, what do you think of this brand? What do you think of this brand? And all I can tell them is, these are my 5 or 6 brands, and these are the supplements in those brands that I can tell you most assuredly have high quality. But there's 45,000 brands out there with God knows how many different supplements. So you have to understand through evidence-based research and through clinical experience which ones really have the true effectiveness.